What if a medicine's main job wasn't to force something new on your body, but to, I don't know, act like a bodyguard for the systems you already have? Well, that's exactly what we're talking about today with linagliptin. It's a drug for type 2 diabetes that kind of represents a whole new, smarter way of thinking about this stuff. So this really gets to the core of it, right? How can a medicine help your body, well, help itself? I want you to really hang on to that question, because the answer is pretty fascinating, and it might just give us a peek into the future of medicine. All right, let's get into the nitty-gritty. So linagliptin, which you might know as Trajenta, is this once-a-day pill for adults with type 2 diabetes. Its job? To help lower blood sugar. Now, it's part of a family of drugs called DPP-4 inhibitors. And trust me, once you understand what that mouthful means, you'll totally get how this thing works. Okay, so before we can really appreciate what linagliptin does, we have to talk about something your body already does. And it's brilliant. It's called the incretin effect. Think of it as your body's own internal command center for sugar. And it all comes down to these super important messenger molecules. And the process is actually beautifully simple. It goes like this. You eat something. Step 1. Then your gut releases these special hormones called, you guessed it, incretins. And what do? They shoot over to the pancreas and basically say, hey, heads up, sugar is on the way. Here's how to handle it. Okay. But this is where it gets really cool. This system is smart. These little incretin messengers aren't just dumb signals. They don't just scream insulin at the pancreas. Nope, they're what we call glucose dependent. That means they only tell the pancreas to boost insulin if and only if your blood sugar is actually high. Super clever, right? And at the same time, they're telling the liver to chill out and not release extra sugar, and they even slow down your digestion a bit to stop that big sugar spike. It's this incredible, perfectly timed dance. So you might be thinking, if our bodies already have this amazing system, what's the problem in type 2 diabetes? What breaks? And, where does linagliptin fit into all this? Well, this is where that bodyguard idea comes back into play. And here's the core of the issue. In type 2 diabetes, that incretin signal, it's just weaker. It's not as strong. And to make things even worse, there's this enzyme in the body called DPP-4. You can think of it as the villain of our story. Its whole job is to find and destroy these helpful incretin hormones. And in type 2 diabetes, this DPP-4 enzyme is working way too hard, just shutting down those messengers way, way too fast. And this is exactly where linagliptin shines. Remember that name, DPP-4 inhibitor? Well, that's literally what it does. It inhibits the villain, the DPP-4 enzyme. It blocks it. It's the bodyguard that steps in front of the messenger and says, not today. By doing that, it gives your body's own natural smart messengers way more time to do their jobs. So here's the real takeaway from this part. Linagliptin isn't some foreign substance forcing an artificial reaction. Not at all. It's all about restoring a natural process. By playing bodyguard to those messengers, it just lets your body's own clever system work the way it's supposed to. For longer, to manage blood sugar much more effectively. But how it works is really only half the story. Linagliptin has this other unique feature that really sets it apart from a lot of other drugs like it, and it's all about how it leaves the body, specifically the kidneys. Just take a look at this. It really shows what makes linagliptin so special. See, most drugs you take are cleaned out of your system by your kidneys, but not this one. With linagliptin, a measly 5%, like almost nothing, goes out through the kidneys. The rest of it, the vast majority, is handled by the gut. This is a huge deal. It's what makes it so different. And why is that a huge deal? Well, it has a massive real-world impact. The source material puts it perfectly. It means no dose adjustment is required for patients with any degree of kidney impairment. Think about that. Even if someone has serious kidney problems, they can take the standard dose. And since diabetes and kidney disease so often go together, this makes linagliptin a super convenient and, frankly, safer option for a whole lot of people. Okay, so we've got the how it works and the what makes it unique parts down. Now let's switch gears and talk about the practical stuff you really need to know, like dosage, side effects, all that important safety info. All right, the dosage couldn't be simpler, really. It's just 5 milligrams. Once a day. That's it. And you can take it with food, without food, whenever. It's designed to be super easy to just fold into your daily routine without a fuss. Now, of course, like any medicine, we have to talk about side effects. The most common ones are usually pretty mild. Think stuff like a headache or feeling like you have a cold. But, and this is really important, you have to be aware of the less common but much more serious stuff. For instance, if you get severe pain in your stomach, that could be a sign of pancreatitis, and you need to get medical help right away. Same thing goes for really bad joint pain or any kind of allergic reaction. And this next bit of safety info is absolutely critical. So on its own, linagliptin has a pretty low risk of causing low blood sugar or hypoglycemia. But, and this is a big but, that risk goes way up if you're also taking it with other diabetes meds like insulin or sulfonylureas. So that's something to be really careful about. Also, just to be super clear, this medication is not for type 1 diabetes, and you absolutely have to tell your doctor if you've ever had pancreatitis before starting it. Whew, okay, we've covered a ton of ground here, right? We've talked about molecular bodyguards, we've talked about kidney function, the whole shebang. So let's bring it all home and pull together the key highlights from all this. So if you're going to remember just a few things, make it these. First, linagliptin works by boosting your body's own smart system for handling sugar. Second, when you take it by itself, it has a low risk of causing low blood sugar. Third, and this is its huge advantage, it's safe for people with kidney disease, and they don't even need to change the dose. And finally, it's just a simple once-a-day pill, pretty straightforward. And that brings us right back to where we started, to that big question. This whole approach, making a drug that doesn't just force a change, but actually protects and enhances what your body naturally does, it's a really powerful idea. It really makes you think, doesn't it? Is this focus on helping the body help itself, is this what the future of medicine looks like?